you are a part of this seminar. The sole objective of Dua Foundation is uplifting the community and creating a visible social impact. In 2015, we launched a program aiming at women empowerment that evolved into a larger vision. And it gives me great pleasure to announce that within 6 years, we've expanded into more than 6 sectors. Our projects in women empowerment, poverty, education, vocational skills, and healthcare sector have impacted more than 2 lakh lives. All this was only possible under the able leadership of Aurangabad Member of Parliament, also our President, Mr. And to those of you who don't know, he also happens to be my father. Moving on, our primary mission was to have a training centers for skilling women and to establish primary health centers in Aurangabad by 2025. Ultimately, our objective is not limited to improving lives in Aurangabad, but to make a meaningful difference in the lives of people all over India. We commenced our operations by launching a project in the sector of women empowerment in Aurangabad, Maharashtra. Under this program, we were able to provide free stitching classes to 50 women per batch, and eventually we could gift each of these women a sewing machine so that they could become self-sufficient in this field. We also tied up with clothing factories, which would then directly hire those women who performed efficiently from each batch. We are on our 6th batch right now, and the journey has only gotten better. We have a team that sits 5 days a week to help create a better route for citizens trying to avail government schemes. We have seen over the years that the government launches multiple schemes, but they fail when they don't reach their target audience. We at Dua Foundation try and bridge that gap between the two. COVID was a tough time for all of us, and the Dua Foundation team was on ground trying to help in every possible manner. We donated saline bottles, oxygen concentrators. We also ran a daily kitchen trying to provide food for people who were left with no one due to the pandemic. We saw the migrant laborers walk all over the country, and there were a lot of migrant laborers across from Aurangabad as well. Our team helped these migrant laborers by providing them resting spaces, food for the journey ahead. We saw during the pandemic a shortage of beds and ambulances. We did a little bit by donating more than 3 ambulances for Aurangabad districts, which are running free of cost as of today. Our plan is to make it into 5 more ambulances. Given my time constraints, I'd like to highlight one more project that we have taken up, which is the police training camp. We organized an entrance test, and according to the scores, we almost selected 150 students who are now being trained for upcoming police service entrance exams. We do have a plan for the coming years, and we wish to further expand our agenda of a safer, educated, and a more inclusive society. And to get at par with the mainstream, we will try our best to bridge the gap between the backward minority and the mainstream, and for that we will need your support. With this, I will take your leave, and this seminar will be taken over by CDCC.